Well, joining me now is Dr. Kelvin Sun. He's an attending physician and clinical assistant professor in emergency medicine based in New York City. Welcome back to the program, Doctor.
Thank you.
So the first 3.9 million doses that we heard of the Johnson & Johnson jet making their way across the country. We keep hearing the same numbers, the protection levels lower than the other two vaccines. Is this a big concern? I mean, are people just getting hung up on these numbers?
Yeah, it's exciting times now. We have the option of choice, but still in these dark times, beggars can't be choosers. 76%, if 70%, it's still better than zero. So if you have the opportunity to get a vaccine, it doesn't matter, Coke versus Pepsi versus Cola Light, just get it, because every little bit counts. The whole purpose of this is to prevent overwhelming hospital capacity so that I don't have to ration care and decide whether you get a ventilator or not, or whether you get an ICU bed or not, because that's the whole point why the ethicists decide which groups of people get it before others. They're the ones that are most at risk. So if you get one shot and it's already 70–80% effective, that's better than getting no shot at all. So I would highly recommend just getting it when you can.
Yes, we do hear this a lot, Doctor, but because it does not need ultra-cold temperatures to store, and as we say, it's only one dose, it would be more beneficial to reach to harder, harder reach communities, more marginalized communities. But there's fear it might be seen as more inferior. So how do health officials address this? For people who say, you're not giving us the good stuff.
So you have to have a very good public health campaign, like what I just did. If you are thirsty, would you turn down a soda, even though that you need is water? And at that point, you take anything. If you're in middle of nowhere where you don't have an ultra-cold refrigerator for Pfizer or Moderna, would you get something that's bunk and will expire? Or something that is known to be stable at room temperatures? If you're very, very thirsty, if you wait too long, you could die by turning down the thing that could hold you over. If you want to get Johnson & Johnson and then get Pfizer and Moderna, I mean, there's no data to support that, but there's also no data to support that it'll be bad for you. But if it prolongs your ability to minimize the probability of you overwhelming my hospital by being a symptomatic carrier, getting super sick, if it means us getting that inferior, if you will, dose, then I think it's worth it. But it's ultimately you have to encourage the individual to want it. And you can't force it on them.
Right,
and that is the effective public campaign that we need from our public health.
Yeah, and Dr. we've been talking for months now about vaccine hesitancy. Now is there the whole issue of brand hesitancy as well that you see among patients?
Yes, so it's the idea of capitalism, I think we have actually created a giant interest in vaccines because the supply was so low. We created this concept like Supreme and Kith and all these clothing brands. I don't understand why people lines around the block just for something, but a logo for something that I already own without the logo. But it happens because people want something they can't have. And now 3 months after the fact, I feel like I'm in this exclusive club. Everybody wants in. I look great 3 months after the fact, being fully vaccinated. I think I look great. And everyone now wants it. All the people who were hesitant about it in December now look at me and like, damn, I just wish I have what you have. This side effect of the vaccine, which is relief, gratitude, joy, euphoria. I want those side effects. It's remarkable to see human behavior changes based on emotion and not on logic. And I think we need to play into what it takes to get people to sign up.
Right. And Doctor, just very quickly, about 30 seconds left. Is this going to be the next flu shot? Will we have to get an annual COVID vaccine down the line?
I believe so. The rate that it's mutating in different people, in immunocompromised people and people who do not get the vaccine, it's creating new mutations. And because we had this issue with measles and getting everyone vaccinated for flu, measles, or anything else since polio and smallpox, we're going to have to expect that there's going to be a bunch of people who won't get vaccinated, refuse to get vaccinated, will get sick, mutate the virus, and we have to start all over again. Therefore, we'll be in this forever until 100% of the population gets vaccinated.
Oh, we can't wait for that. Dr. Kelvin Sun with very important information. Thank you so much.